It is 8:15 in the morning and pupils at the Tower of Love Primary School are singing devotion. This school at Congo Water, Wellington, in the far east of Freetown, pupils and teachers carry on with the normal educational activities, despite the fact that the COVID-19 disease continues to infect dozens of people every day and it remains a health risk. Schools in Sierra Leone were shut down on March 31, 2020 to prevent the spread of the deadly coronavirus that was declared a pandemic in early 2020. In July, the Ministry of Health and Sanitation and the Ministry of Basic and Senior Secondary Education had agreed to reopen the schools but issued strict health protocols such as mask wearing, hand washing, and social distancing to be respected at all times.
One, the hand hygiene is very, very much important. That is, they should be provided with facilities and they should be supervised. For them to be able to wash their hands with soap and water or use what we call alcohol-based hand rub at all times. The other important thing is safe distance. The schools should make sure that their sitting positions are arranged in such a way that they are not very close to each other. And above all, the proper use of mask, or what we call a face covering with at least 2 layers of protection, is overly important in the prevention of COVID-19.
In October 2020, UNICEF urged countries to prioritize education in order to reduce the negative effects of COVID-19 on children. Out of 24 countries in the West and Central Africa, only 6 had opened the schools by October, including Sierra Leone. According to the World Health Organization, hand washing is one of the most effective actions to reduce the spread of pathogens and prevent infections, including the COVID-19 virus. Pupils must wash their hands for at least 20 seconds with running water and plenty of soap to kill the virus. But on the aspect of mask wearing, these little children replicate what they see in the adults. Some wear it properly, some wear it as an item of fashion, and others don't wear it at all.
We know that it's a deadly disease, very dangerous, and it's easy to be transmitted from one person to another. So if government came out with measures which has to be taken in order to stop the spread of the coronavirus, we definitely have to adhere onto it, because it will be detrimental to us. And since the children are coming from different homes, if anyone is being affected, it will be simple to be disseminated.
Head teacher Mr. Lamin Kuruma describes why it is important that pupils must wear protective facial masks while they are inside the classroom.
According to the medical practitioners, they told us that we need to put on these face masks in order for us to prevent us from this deadly virus, because by putting on the face mask, it helps us to reduce the risks of contacting the virus.
The World Health Organization advises that children under the age of 5 should not wear a mask because they are less likely to wear it properly, and those aged between 5 and 12 should wear a mask under adult supervision. But how does one explain to kindergartens about the coronavirus?
Every day, we teach them about that, how to wear your face mask, how to prevent it. When you go home, we even tell their parents every day they should wash them before coming the other day.
Mr. Kuruma again explains the proper way of wearing the mask and how difficult it is for children like the ones here to adhere to the safety measures.
But the proper way of wearing the face mask is to put it on like this, from your nose till down to your mouth. If I tell you that it is easy, no, I'm lying. It's not really easy, because you know that these things are new measures they brought for us, because we never experienced this disease before. Before we heard about Ebola, but they never told us to put on face masks. So whenever we are in school, in order to tell the children or to explain to them to put on their face mask is very difficult.
The World Health Organization does not fully understand the role of children in the transmission of the novel coronavirus. However, children can be asymptomatic carriers of the virus. This means that they can have the virus and spread it without knowing it. And when they return home, they can spread the virus to parents and grandparents who are more vulnerable. But this risk is not well understood here in Sierra Leone.
The principal is very, very strict. They begin there and they become max. They drive and go to take a max. So that's said we pray God for Randy and we only appreciate him.
Some measures are better than no measure at all. At this school, children continue their very important education while at the same time learning basic health protocols and behavior. These hygiene habits could help protect them not only from the COVID-19 but also from other more dangerous diseases. That is one of the few positive lessons that coronavirus has taught us. For Glad TV Online, this is Abdullah Gla reporting from Kungu Water, Wellington, Freetown, Sierra Leone.